Have you ever wondered if your hormones are deficient? All you may have to do is look into a mirror. Dr. Clark Hansen with the Hansen Clinic of Natural Medicine is here to show us how your reflection may be giving away more answers than you think. Good morning, doctor. Good to see you.
Good to see you.
Let's talk about one of your patients, Katherine. Tell me about her.
Yeah, Katherine is one of my typical patients in menopause. She was 61 when she first came to see me. She'd had menopausal symptoms for 10 years. They're happening 10 years earlier and lasting 10 years longer now. So here's Katherine. Just an amazing story. The success rate is so phenomenal when we treat these patients, but look at her face. She was seeing all these symptoms showing up already in her, so I'm going to point those out when we look at her picture.
Let's talk about when we look into the mirror and we look at our face, and when Katherine saw her face, what kind of hormone deficiencies can you tell that they have?
Yeah, women are looking at this in the mirror, so they're trying to figure out what this is.
We scrutinize our faces in the mirror.
So in her case, start at the top, her hair. It's brittle, it's short, it's breaking off, it wasn't growing. That's a thyroid deficiency symptom. Deep furrows in the forehead and the brow, those wrinkles are due to human growth hormone deficiency. Also the sagging eyelids, the upper eyelids that are just falling down, closing her eyes almost, that's human growth hormone deficiency. The deep jowls, the nasolabial folds, that's also growth hormone deficiency. The fine lines and wrinkles around the eyes, that's estriol and testosterone deficiency. And then what she was really complaining about, she called her chicken neck. The sagging of the neck, the wrinkling of the neck, the jowls are wrinkling. She said everything was going south, everything's sagging. Even her knees were fat. It's just sagging. That's a human growth hormone deficiency.
So why do you think so many women right now are having these problems and experiencing these issues?
Environmental chemicals. We are just being bombarded by plastics, pesticides, hormones that are fed to dairy cows and beef cows, the nonstick coating on our pans, those all cause endocrine disruption that block endocrine function or excessively stimulate the estrogen receptors. Those are all causing havoc that makes menopause come earlier, longer, disrupting it just forever.
And making our lives miserable.
Yeah.
So what are the symptoms of a growth hormone deficiency?
So growth hormone is the hormone that regulates collagen and elastin. So everything to do with collagen, which is our skin, so wrinkling of the skin, hardening of the arteries, stiffening of the joints. So she's got arthritis. She feels like a rusty gate. So her symptoms, are kind of a mix. You see most of them here are human growth hormone, HGH. But also the typical hot flashes, sleeplessness, that's estriol. But arthritis, the sagging of the skin, the thinning of the skin, the deep wrinkles, even some of the anxiety and depression is related to growth hormone. She also had, of course, low sex drive. She had osteopenia, beginning of osteoporosis. All these things are all of the hormones. They all need to be looked at and treated.
And speaking of looking at them, which hormones should we test and how do we treat them?
Yeah, so she's a great example because she's got deficiencies in almost all of them.
Yes.
Except for 3 that she was being treated for. So finally she went to a gynecologist who gave her a prescription for synthetic. The only 3 that are listed as H there in the initial labs that are high, progesterone, estrone, and estradiol, those were too high because she was getting a patch that was making them too high. When you get too much progesterone, it actually decreases growth hormone even further and made her case worse. She was getting the estradiol and estrone, which are known carcinogens that increase a woman's risk of cancer, and she still had hot flashes. So what we did was we treated all ones that were low and gave her the natural bioidentical hormones to replace the synthetic ones.
How do we take the bioidentical hormones?
So the best way to take them is a sublingual dissolving. So we have a 2-piece capsule you pull apart and pour underneath your tongue. A simple powder dissolves within 10 seconds under your tongue at bedtime every night. You replenish the level every day. You never get too much of a buildup. The pellets just are harmful because they give the wrong estrogen. You can't give the healthy estriol because it doesn't last that long. So they use estradiol, which is 1,000 times more potent, which creates the side effects. You don't want that estradiol in your body unless you are on a lab test way, way low.
A lot of people, a lot of women out there feel like Katherine. They want to seek help. They want to seek your advice. You have a special offer. Tell me about that.
Well, we want everybody to learn about this. It's not just a nuisance. They need to get their hormones tested. So for the first 25 viewers who call in or go online to our website and register for a free test, you're going to get a free estriol test. That is the key estrogen. Women need to know their levels. It's a $130 value we're giving away to the first 25 callers or those who register. All you have to pay for is the blood draw fee. Then we want to give you the information about what to do with it.
Dr. Hansen, thank you so much helping so many women out there. We appreciate you coming
you.
in. And if you would like to learn more information about the Hansen Clinic of Natural Medicine, you can visit their website, drhansen.com, or call the number you see right there on your screen.